Good morning, everyone. Okay, this video is recorded to explain to all the girls who underwent a vaginoplasty or who are facing to have vaginoplasty in our center the proper way to make dilations. That's very important for the follow-up, because if not, you won't get a good result in terms of deepness and in terms of wideness in the long term. Even if you got 20 centimeters length vaginoplasty after our surgery. So that's very important. And for that, the most important thing to take in consideration is you need to know what is the normal anatomy of the pelvic belt and of the sacral bone. That's very important, because if not, it's very difficult to make properly the dilations. So, if you take a look to this model, you'll see inside the belly, you find there the sacral bone. The sacral bone has this important curve. So, the moment we are trying to make the dilations, we need to get this position with the dilator. Because we leave there 20 centimeters length vaginoplasty. So it means the top of your vaginoplasty, the end of vaginoplasty, will be located at this point. So you need to travel through the sacral bone with the dilator through its curve to get this position. And for that, it's very important to understand the moment you are lying down on the bed. Usually, most people make the dilations in this position, lying down on their bed. So, you are going to introduce the dilator in this position, okay? Through this way, you're going to put the dilator inside your vagina. But 2, 3, 4 centimeters after having introduced the dilator inside the vagina, you'll find the sacral bone if you don't change the position of your hand. And that's a very, very difficult position, a very dangerous position for your rectum, because if you push hard, trying to get a deeper position with your dilator towards this bone, you'll find in the middle of the rectum, and you risk to have an injury over the rectum. You risk to have a rectal perforation, which is a very important complication, very difficult to solve, and only through a new surgery. Okay, so it's very important to make the things in the proper way. And for that, the proper way to make the dilation is you introduce the dilator in your vagina, and 2 or 3 centimeters after having introduced the tip of the dilator inside the vagina, in that way, you change the position of your hand towards your back to change the position of your tip of the dilator inside your belly to try to travel through the sacral bone, through the curve of the sacral bone, and to get this position. Okay, so we introduce in that way 2 centimeters or 3 centimeters after having introduced the dilator inside the vagina. You change the position of your hand towards your back, touching almost the bed. You change the position of the tip of the dilator towards your belly, towards the front of your belly, so you can get this position without any risk. That's very important, okay? Most people don't do it properly, and they complain because they find sometimes 7 centimeters after having introduced the dilator inside the vagina, they find something very hard, very difficult to progress when they find this position, because they are touching the bone, and at the same time they feel the sensation for the need to go to the toilet for poo. So that's because they're pushing hard towards the rectum. That's very dangerous. So the moment you are making the dilations, if you have the sensation, you need to go to the toilet to poo, it means you are pushing hard towards the rectum, and that's very dangerous. So stop, okay? Stop. Don't progress in that way. That's a very dangerous way. The only thing you need to do is to change the position of your hand towards your back, touching the bed, pushing after that the dilator inside the belly, so you'll follow the sacral bone through its curve to get this position. Okay? This position is located in the middle of the belly, more or less. Okay? So, very important. This is the proper way. We introduce the dilator 3, 4 centimeters after having introduced it. We change the position of your hand, pushing the dilator inside the belly. In that way, progressing inside the belly, but change the position of the tip of the dilator towards the front of your belly to try to travel through the curve of the sacral bone and to the sacral bone to get this position. Okay? That's very important. If you don't do the dilations in that way, you won't find a good result in the future because you'll find the tissues there closed several weeks after the operation. So that's very important to do these dilations in the proper way. It's not something comfortable. It's something sometimes painful. I recommend you to wait a little. The moment you feel pain, making the same pressure, pushing a little, trying to relax, because you'll find in the middle there, the pelvic floor, this is a muscle. If you push through this muscle, you feel pain and you find the muscle absolutely contracted, you won't have the possibility to progress anymore. So the best way to do it, you push a little, you feel pain, okay, keep doing the same pressure. Try to relax. Try to relax the pelvic floor, and after that, you'll see it won't. It will be much easier to do it. Okay, you'll feel the sensation. The dilator is progressing by its own instead of progressing because you need to push hard over it. Okay, so that's the best way. But please, I beg you, remind this anatomy the moment you're making the dilation. That's very important. That way at the beginning, change the position to your hand towards your back, to change the position of the tip towards the front of your belly, and to try to travel through the curve of the sacral bone to get this position inside the belly. Okay, that's really important. Okay, thank you very much for listening, and I'll be there another time to explain you more things about all the procedures we have in common. Have a nice day. Bye bye.